Introduction and the gap in modern medicine. Imagine your cardiologist holding up a scan of your coronary arteries and pointing to areas of significant concern. You see visible buildup, calcium deposits, and narrowed passages. This is the early stage of a condition that claims more lives than any other disease across the globe. Your doctor prescribes the standard medications, tells you to watch your diet, and sends you on your way. You leave the office thinking, is that really all there is to it? Because deep down, you have heard that the food you consume can either rescue or destroy those arteries. You just haven't been given the specific, actionable details. Getty Images. Tanishuv. Today, I want to share a truth that almost no doctor brings up during a routine appointment. A common kitchen ingredient that costs $1 or $2 at any grocery store has been studied in rigorous, randomized controlled trials specifically for its effect on coronary artery plaque. The results are so remarkable that even seasoned experts were caught off guard. This information isn't missing because your doctor doesn't care. It's because the research is incredibly new. And there are no giant pharmaceutical sales representatives knocking on doors to promote something that cannot be patented. I am Dr. Sarah Mitchell, and this channel exists to close that gap. We create content specifically for adults over 60 who want real, evidence-based answers, not just generic advice. If you haven't subscribed yet, hit the button now, because the information I'm sharing today takes years of digging through medical literature to find, and I've condensed it all for you. The root cause of atherosclerosis and the garlic miracle. Understanding how plaque actually forms in our arteries helps us realize why garlic is so extraordinarily effective. Most people believe that plaque develops simply because they ate too much fatty food. In reality, the process begins with inflammation of the inner lining of the artery wall, called the endothelium. Over the years, exposure to high blood sugar, chronic stress, smoking, and low-grade inflammation damages this delicate lining. Once the artery wall is damaged, it becomes sticky. Cholesterol is often just a passenger in this process. The real driver, the fire that burns through your vessels, is inflammation. White blood cells rush in to repair the damage, but they get trapped inside the wall, accumulate fat and calcium, and harden into the deposits we call plaque. This is precisely where the miracle of garlic comes into play. Garlic contains a compound called allicin, which is one of the most potent natural antioxidants and anti-inflammatory substances ever discovered. However, there is a major catch. Allicin is chemically unstable. If you cook it, the heat destroys it within minutes. If you eat it raw, your stomach acid degrades it before it can ever reach your bloodstream. This is why, after years of research, scientists developed a specific form called aged garlic extract. In this form, the beneficial compounds are preserved and transformed into stable molecules that travel directly to your arterial walls. Take the case of a patient named Margaret. After 14 months on this protocol, her coronary calcification completely stopped progressing, and her systemic inflammation markers dropped by 38%. Clinical research and the impact on blood pressure. To prove that this isn't just another internet health myth, let's look at the clinical data. A prestigious medical center in Los Angeles conducted a randomized control trial involving dozens of patients with measurable coronary calcium. Half the group received aged garlic extract daily, while the other half received a placebo. After 1 full year, the garlic group showed zero progression in their coronary calcium scores. This wasn't just a slowing of the disease. It was a total halt. Even more shocking was the discovery that low attenuation plaque, the soft, unstable kind most likely to rupture and cause a heart attack, actually decreased in volume. This was a revolution in science. We weren't just stopping the problem. We were beginning to reverse it. Beyond the plaque data, the research on blood pressure is equally compelling. A meta-analysis of 20 separate, controlled trials found that garlic supplementation reduced systolic blood pressure by an average of 8 to 10 points. This is a result comparable to many prescription medications, but without the side effects that damage the liver or kidneys. This happens because a specific compound in garlic, called SLL-cysteine, helps relax the blood vessels and improves overall circulation. For many seniors, This means a higher quality of life and potentially reducing the need for heavy medication. If you struggle with high blood pressure, this natural strategy can be an incredible addition to your doctor's prescribed treatment. Every vessel in your body finds relief through this mechanism. Garlic is not just a plant. It is a natural engineer for your circulatory system, the gut-heart axis, and systemic protection. Modern science has revealed another fascinating truth. Garlic heals your heart by first healing your gut. You might wonder, what does the gut have to do with the heart? The connection is actually profound. We call this the gut-heart axis. Aged garlic extract acts as a powerful prebiotic, providing nourishment for beneficial bacteria like lactobacillus and bifidobacterium. When these good bacteria thrive, they lower the level of systemic inflammation throughout your entire body. We now understand that arterial inflammation often begins in the gut. If your microbiome is healthy, your arterial walls are much more likely to remain strong and elastic. Additionally, garlic has a measurable antiplatelet effect. It works similarly to aspirin by naturally thinning the blood and preventing it from becoming too sticky. However, it does this without the risk of stomach bleeding often associated with long-term aspirin use. Studies have shown that it can inhibit platelet aggregation by up to 58%. This is a massive advantage in reducing the risk of strokes and heart attacks. Take Harold, a 74-year-old retired teacher. Despite being on a statin for years, his inflammation markers remained stubbornly high. After 12 weeks on the garlic protocol, his inflammation dropped to normal levels and his blood pressure stabilized. His cardiologist was so impressed he said, "Whatever you added, keep doing it." This is a systemic shift in your biology. You aren't just treating one organ. You are upgrading your entire body's defense system. The protocol, safety, and final verdict. Now we come to the most critical part. How do you do this correctly to see real results? It is vital to remember that not all garlic supplements are created equal. You specifically need aged garlic extract. On the label, look for the brand name Kyolic or a product standardized to contain SLL-cysteine. The most effective dose used in clinical trials is 1,200 milligrams per day. It is best to divide this into 2 doses, 600 milligrams with breakfast and 600 milligrams with dinner. Taking it with food improves absorption and ensures it is gentle on your stomach.